Yeah, thanks a lot. So as Benno said, I'm mainly working on Ebola epidemics, and we also did work on the COVID-19 pandemic. We still do that actually. And we're also planning work more in the direction of One Health and planetary health. My group mostly works in African countries. So and today I'm going to talk about anthropology of snakes, from magic to the decolonization of thought. And I'm doing this, and this is indeed also a very far topic for myself, because as I said, I'm mainly working on epidemics, not really on snakes. But I found it quite interesting. And I hope at the end of my talk or presentation, you will also understand why I find it so intriguing, interesting, and also inspiring. So what I'm going to... Oh. What? So I first give you an overview about snake bites in the anthropological body of scholarly literature, so the state of the art. I'll give you a rare example of medical anthropological research on snake bites, and then I'll talk about 3 anthropological perspectives on snake-human relations. Yeah. So how do anthropologists look at human-snake relations? And then I'll discuss the question how to integrate local knowledge, which is actually the question which runs through my presentation. Yeah. So as I said, I'm not an expert on snake bites, nor snakes, and many other things. But what I do as an anthropologist, when I'm concerned with a new topic, you look into the anthropological existing literature, right? And then what I'm going to tell you now is mostly what I did not find, and I characterize you why that is interesting. So first of all, there is little anthropological literature on snake bites, snakes, and then snake bites and snake bites specifically in African countries. You will find more in South Asian contexts, but less in African contexts, right? Then one of the reasons why it is maybe also why there is little medical anthropological literature on snake bites is that medical anthropology as a discipline of the last 20 years, 30 years, has been mostly concerned with epidemics or pandemics, HIV, Ebola, and now other diseases. Now the topic is, or the medical anthropological focus is also moving more into One Health research, where you also look at animal-human interactions or animal and human health, but it rarely does include snakes. And there's one important reason why it does not include snakes, because most of the literature, anthropological literature on snakes, is coming from the so-called hunter-gatherer relationship literature. So hunter-gatherer societies. If you look into, say, have a very broad anthropological, archaeological perspective, you would classify societies according to the extent they are hunter and gatherers, by which we mean, for example, those people who ethnic groups, which you would call sometimes bush people, but also all kinds of communities living around the circumpolar Arctic region, Canada, Soviet Union, former Soviet Union, Russia, Finland, and so on and so forth. Classical hunter societies, which have a different cosmology, right? Hunting is the important relationship here between animals and humans. And snakes are interesting, like leopards, because they are also hunting humans, or that's how it is perceived. So you'll find in the hunter-gatherer literature lots of local assumptions, beliefs, knowledge about snakes. Yeah, rarely in societies which we call agricultural societies. Of course, these are very broad categories. Yeah, today's societies are, of course, much more diverse, fluid. But in terms of anthropological literature, that's where you would find most, if you would find something, you'll find most accounts about snakes and snake bites. Now I'm giving you a more recent example about medical anthropological work on snake bites, an article which I found, which is also really one of the few I found, by Romain Douda and Tamara Gilvernick. Tamara Gilvernick is an anthropologist working at, I think, the Pasteur Institute in Paris. And they published a paper integrating lay knowledge and practice into snakebite prevention and care in Central Africa, a hotspot for envenomation. I'm not so sure whether, but Bernhard will probably know that. So, and I found interesting what she writes. I just quote you one of a few things. You can read it also in later, snakes occupy a prominent place among other mystical animals like leopards, gorillas, chimpanzees. So they are different from chicken, cows, and other kinds of animal husbandry animals. And they have a charismatic behavior and attract human attention and theorization. They are seen to share with these animals the capacity to change their appearance, and to serve as a vehicle for powerful human beings. So this is somehow the core element of all myth narratives and local regionalist beliefs about snakes. And the most important part here again is snakes' predatory behavior is linked to witchcraft, which is understood in terms of quest for accumulation of wealth, accumulation and wealth, and so on and so forth. Can be also different kind of interpretations. The point is, it's the snake's predatory behavior, because in hunter-gatherer societies, relations between animals are defined by prey and being prey and preying others. And you also have some interesting pictures or snakes are also apparently part of myth, like the Mamiwata figure. I'm here presenting a picture of one of the first posters taken in St. Pauli, Hamburg, just around the corner here in the late 19th century, where apparently a snake tamer was presented here as one of the fairs, as an exotic kind of exhibition thing. And then this poster was made for a person called Karl Hagenbeck, a fish merchant from St. Pauli, Hamburg. And the poster was done by Friedlander Company. I think that's the typo, sorry, So if you're interested, about this, one of the rare examples of a Mamiwata figure presentation, you'll find it here in Hamburg, actually. But this also shows you, actually, that myth about and local beliefs about snakes in so-called colonial or pre-colonial societies are not so traditional. Already then, the world was in a process of globalization. People were moving, circulating, and with them also the stories and the myths they took with them. And of course, they were received here, transformed, and so on. So you'll find, of course, I'm not an expert on Mamiwata beliefs, but it's more prevalent in diasporatic societies than in local communities, apparently. So you see it more in European or North American contexts. So what is now interesting about these local beliefs? And now I'm returning to the medical anthropological work on snake bites. The question is, how do you integrate these local beliefs and beliefs in witchcraft, oracles, and so on into medical interventions, which are concerned with the prevention and care of snake bites, right? So this is now the question. And I think, which I cannot really answer, of course. And then, of course, as I said, you have to understand that there is some sort of difference to other animals in the sense that snake-human relationships are always interpreted in the sense of, in terms of a victim-perpetrator relation. So somebody wants to hurt you. It's not an accident. So the snake is not defending itself. And then it can be interpreted in various spirit-human interactions myth. So how do you integrate that into local knowledge? And is it at all possible to integrate local beliefs about spirits into scientific concepts about snakebite and envenoming? And this is, of course, maybe this is a question that you come across if you are concerned with such spirit beliefs. I find it interesting because anthropologists too have to answer this question when they write about these stories, because most anthropologists trained at universities are, of course, not believing in spirits, nor in oracles, nor in witchcraft. But witchcraft has, of course, significant consequences in societies you work, dramatic consequences sometimes. So I'm going to present you now 3 anthropological ways to integrate these local beliefs about snakes or other animals. The first most prominent one is the classical one, also by Alan Pratchett, saying that within a certain context, magic is logic. It's logical to believe in certain magical beliefs. So it's a rational response to the apparent randomness of misfortune but under given context. So his example is always, you know, two men are sitting under a hut, the hut falls down, kills the two men, and then you as an observer say, okay, the termites have been eating the foundation, so it was at some point inevitable that this house would collapse. Of course, the Asande would ask, yeah, but why did it happen now and kill the two people now? Maybe because those two guys were doing something else before, yeah? So in that kind of assumption, that reasoning is logical according to Evans Pratchett, yeah? So these beliefs about witchcraft, yeah, that make the hut to break down and kill those, precisely those two guys at that particular moment. They could have also gone somewhere else, but they didn't. So what Aurelia described as contingency is not contingency, it's misfortune, and that has to be explained, yeah? And according to Evans Pratchett, the classical work, well, it tells us something about how humans think everywhere in the world. They need to find an explanation. And that's what logic is about, yeah? They want to make sense about misfortune. And that, in the way how they do it, that tells us something about their societies, yeah? Whether it's witchcraft science or whatever. I'll just give you a picture of this, yeah? So scientific explanations of snakebite envenoming, you know, looks at how humans and their belief systems, yeah? And then snakes have a natural explanation. And that's what we call relativism. We don't question the truth or the falsity of the statements that our interlocutors give to us. We try to make sense of them, assuming that they are logical in a way. I'll give you another example, which I call the critical and pragmatic analysis of colonial histories of violence. I'm quoting here the work of Frantz Fanon, whom you might know is one of the most important post-colonial thinkers, writing about decolonization. And he has one rare remark in his entire work, which is in many ways also for historians of decolonization and colonial oppression. It's a bit of controversial work, but here he states, malevolent spirits who emerge every time you put on foot wrong, if you put one foot wrong, leopard men, snake men, six-legged dogs, and zombies that encircle the colonized over a realm of taboos, they are frightening. They are part of the world. But, and that's in the colonial world, but in the liberation movement, when decolonization takes place, yeah, then people start to become pragmatic. They are concerned with the real issues at hand, saving lives, yeah. If somebody gets bitten by a snake bite, he will search for the best way to save his loved one. And that's a pragmatic thing. So what Frantz Fanon does is, yeah, so humans can switch pragmatically between local beliefs and scientific explanations, yeah? But the real world that we are talking about is a political world shaped by decolonization in his context. Today, we might say other things are shaping our world, politically, I mean, yeah? And it's important to know that Frantz Fanon was a psychiatrist, right? So he was trained in France as a doctor, but working in Algeria. Yeah? So I'm also not so sure whether his example from the snake, but he was coming from the Antilles, so from the West Indies. So I'm not so sure to what extent the remarks on the zombies are rather part of this Caribbean voodoo culture. Anyhow, he, of course, as a psychiatrist, did not believe in those myths, but they are part of the reality of the oppressed. Yeah. So if people are under pressure, they resort to certain religious beliefs, but it's pragmatic. If you change the situation, also their beliefs change. Here, I think you as medical people, you will also see somehow probably more kind of immediate relations. You know, you always also have to think about the public health system you're working in, the political circumstances you're dealing with when you talk to local people, right? And also when you think about prevention and care. Now I come to something which is really novel in anthropological literature. So this is a theory, anthropological theory, or what we call anthropological theory, and it's not old, it's very new, yeah? And it's called perspectivism and multinaturalism, yeah? So these are works like How Forests Think, and literally means that the author asks himself how the forest think. And you can also abstract how the leopard thinks, yeah? How the leopard appears in dreams and what this thinking tells us, yeah? Or then he doesn't talk about Eduardo de Cohn, he doesn't talk about snakes, but as I said, snakes and leopard belong to the same category. The most important, currently the most important anthropological thinker is Eduardo Viveros de Castro, and he coined the idea of perspectivism, a multiplicity of worlds we are living. I'm going to show you what it means in a moment. The problem about relativism I presented you in the first case, yeah, well, people have their beliefs, we have ours, no problem. There is a problem, of course, when you have to treat snake bites and people don't come to you because they go to the traditional healer. Then your relativism is at a point where you have to make a decision, yeah. So relativism doesn't really help us in neither understanding nor actually expressing our analysis in a particular way. Yeah, it's not interesting for anyone except the one who tries to make sense of it. With pragmatism, you are more hopeful in the sense that, okay, well, when things change, also people change. There's little you can do about it if the political system is hard. Yeah. With perspectivism, it's a bit different. Yeah. You try to be radically relativist. Yeah. So as I said, anthropologists also don't believe in witchcraft, but they also know that their modernist thinking is based on certain assumptions about the world. Yeah. And some of the anthropologists, like Eduardo de Castro de Vivero, find it interesting to draw on these hunter-gathererness, witchcraft beliefs, to rethink our understanding about what humans are. So the classic example he brings is Amerindian perspectivism. So in normal conditions, humans see humans as humans, animals as animals, spirits as spirits. However, animals, so the predators, and that's why predator stories are so important in world history. Predators and spirits see humans as animals, yeah, as prey. Yeah, so the leopard is for the leopard, beer is maniok. The blood is maniok beer. He drinks blood like maniok beer. Yeah, and to the same extent that animals as prey see humans as spirit, or as animals, by the same token, animals, spirits see themselves as humans. So in the Amerindian perspectivism, the idea is everybody is human, just changes its shape. It appears in different shapes, bodies, yeah, as leopard, as human, but they're all part of humanity. That's somehow what you can understand as some sort of descendant story, which you find in many kind of myths, that at the origin there is a human, but the world is undifferentiated, everything is human. Yeah. So it's interesting, yeah, but the point now is that, well, if we radically want to rethink our understanding about humanity, yeah, then maybe some of these myths are helpful to change our perspective. And then let's see what happens. So in the normal scientific world, we have science explaining what humans do and science explains to us how humans behave, how humans interact with snakes. In a native cosmology, it's actually the other way around. You also include what the snake thinks about humans and themselves, yeah? So the world is much bigger, yeah? Why would you do that? I'm coming to this point. So I showed you two ways, and I'm going to come to the last point in a moment in my summary, how to integrate local knowledge into public health intervention. So relativism, pragmatism, critical ways, you know. So I still think that relativism is an important methodological stance. So that's what also Aurelia told you about when you conduct an interview. It doesn't make sense to assume that they are wrong, the people. Yeah, doesn't help you nor the conversation that goes on. And then often you will also realize, of course, that, you know, when people say something, what they do is often something else. And that's why you also observe. Yeah. You stay in the hospital and see what they do actually. Maybe they talk about witchcraft, but at the same time, they also go to the hospital. Yeah. And that's what you see every day. Perspectivism is interesting because you want to decolonize, and that's why the authors I've been mentioning are right now so popular, want to question about how we think about us in a world shaped by climate change. You may call it Anthropocene, and other kinds of effects that degrade our environment. Yeah. The most scientific explanation for this is, well, humans are egoistic, whatever. So there are many assumptions which you cannot prove empirically. Yeah. So in such a situation, it might be helpful to change your perspective. And that's what you do when you do fieldwork. It's a classical understanding of, so the methods that Aurelia was presenting is, of course, on the one hand, you want to gather information, yeah, collect as many rich data as possible. But the end of fieldwork is also, maybe you are confronted with perception, and at the end of the day, you also want to change your perceptions. Yeah, and that's what Tim Ingold, another important anthropologist, calls, you are actually educating your perception. Yeah, maybe it's not necessarily the same way that your informants will perceive the world, but maybe it changes the way you perceive the world. And if climate change and other things are not be tackled with our understanding about the role of humans in this world, maybe it's time to change your perceptions. How do you do that? Yeah, other than getting inspiration from other worldviews. Okay. More practically, it's worth thinking about expanding about, more generally try to think about human-animal interactions in all kinds of different ways. Yeah. And some of it we will never accept, maybe rationally or irrationally, but there's more to be talked about when we talk about, ecological transformations that happen. And that's why I find it so fascinating, because usually I don't talk about snakes, and perspective is not really what even my researchers in my group think. It's a bit weird, but I do understand where these discussions come from. And yeah, and maybe you find it at least one of the kind of ways to integrate knowledge interesting for your own work. Yeah, thank you very much.